The broadcast is now starting. All attendees are in listen-only mode.
Hello, everybody. This is Danny Barbaro, and I want to welcome you to this installment of the Practice Perfection web-based education series off from our October hiatus. Before we get to today's event and very special presenter, I want you to know that Practice Perfection webcasts run for 90 minutes. While attendees are in listen-only mode, we invite you at any time to submit your questions or comments using the question button on your screen. We will allow time following the presentation to get your questions answered. And I just want to make sure we're in the right mode here, which we are. If we do not get to your question during the webcast, as always, we'll see to it that it is answered shortly thereafter. Today's presentation is entitled Connecting the Dental Medical Dots and is delivered by Robert Schulhof. Bob has a master's degree in mathematical statistics from UCLA and in 2004 founded the Centers for Dental Medicine. He has published over 30 articles in the dental literature on this topic. The Centers for Dental Medicine, CDM, is the established leader in oral systemic medicine, as exemplified by the fact that CDM has held the #1 Google ranking for oral systemic medicine for 10 consecutive years. 70% of people over 50 have a problem connected to oral inflammatory disease. The key challenge facing practitioners is conveying an active message of urgency as distinguished from taking a wait-and-see approach. Bob demonstrates how to present this problem as one the patient recognizes as urgent, as they would with any other chronic systemic condition, such as high blood pressure, asthma, or arthritis. CDM has been the innovator in delivering a complete system of training, equipment, and products for dentists combating such oral inflammatory conditions as periodontal disease, sleep apnea, and heavy metal toxicity. Bob works with team members to perfect their CDM diagnostic technology and communication skills to gain unprecedented patient treatment acceptance. As you will soon hear, Bob is that rare and refreshingly welcome combination of intellectual and plain talker. Now, attendance at this presentation entitles you to receive 1.5 hours of continuing education credit. Shortly following the webcast, you will be emailed a brief survey with instructions on how to receive your CE. Participants are cautioned about the dangers of incorporating techniques and procedures into their practices if the course has not provided them with adequate clinical experience to allow them to perform it competently. And now it is my pleasure to welcome Mr. Bob Schulhof. Hello, Bob.
Hi, Danny. Well, I thank you very much and AIM Dental Marketing giving me this opportunity to present what I consider really the most exciting development that's going on in dentistry today. I'll just introduce myself. I'm the one without the hair. That means I just had more testosterone than Dr. Reed. But I got my master's in mathematical statistics. Actually, Hughes Aircraft Company put me through school. They gave me a Hughes Master's Fellowship. And unfortunately, after we did land on the moon, I worked on the Lunar Surveyor project. That was my first job. We really didn't have any need for guys like me anymore, so I had to go get a real job. And I ran into a dentist named Dr. Robert Murray Ricketts, and he got me involved in orthodontic research. So I started an orthodontic company, went into orthodontic research. I took that orthodontic company public on the NASDAQ in 1997, and I merged my company with Dr. Omer Reed, who was then and is still the leader in non-surgical periodontal treatment. So all my motivation here has really, for this program, has really been for the last 10 years through Dr. Reed. So I thank him. And that's my introduction as to who I am. Now, if you want to find out who we are another way, go to whatever your favorite search engine is and put in the words oral systemic medicine, and you'll see about 8 million results, and we come up first, called the Center for Dental Medicine, And you can go to our website and look around and look at all of these factors: laser connection, inflammation, diabetes, nutrition, dental professionals. So there we are. So we are #1 on top of oral systemic medicine, and of course what we're talking about tonight is oral systemic medicine. We have about 80 dentists throughout the United States that we've worked with and we've trained on this program. We actually have one in Australia now. Published a number of articles. Here's one in Dentistry Today that you can kind of chuckle out. It was called Connecting the Dots. This was back in May of 2009. Can your practice be in the life-saving business? So what we're presenting today really isn't totally new to me. We've been connecting the dots and saving lives for many, many years. However, there's something new. What I've found, which has always bothered me, is that dentists don't get no respect. It's almost like, okay, go ahead and clean my teeth. I know you're not a real doctor, so get on with it. Well, that bothers me. And the question is, what if you, the dentist, could successfully lower high blood pressure, lower LDL cholesterol and increase HDL, improve arthritis, lower the risk of negative events for COPD patients? In other words, if somebody has a breathing problem, you could keep them from dying. Reverse blood sugar problems in diabetic patients, lower the risk of eye problems, and even prevent Alzheimer's. Now, if you could do these things, would your patients then finally appropriately value the services you provide? And here's the problem I've had with the classic discussion, even selling periodontal disease, which we know is connected to all kinds of systemic diseases, is the classic discussion is, well, you've got bleeding gums and you have periodontal pockets. This means you have periodontal disease. This could cause you to lose your teeth prematurely and even increase your risk of heart disease and diabetes. Now, treatment what we recommend will involve deep cleanings, possibly every 3 to 6 months. It's somewhere around $900 a session. Okay, so the patient's sitting there listening, and what's going on in his mind is he says, why should I pay this good $900 now and get this treatment for what looks like a possible benefit? You know, maybe lowering my risk of losing teeth, lowering my risk of heart disease and diabetes. So let's put him off a little bit. Say, okay, doc, I promise to do a better job brushing and flossing. Let's see how I am next recall visit. And I know that you guys have heard this over and over, but this is why less than 10% of the people statistically actually accept periodontal disease. And we will be talking about what you can do about that. Now, as I said, I'm a statistician, and so sometimes I just look at the research to see what's there. And this is what woke me up about a month or so ago. The Johns Hopkins Bloomberg School of Public Health said that 70% of Americans over 50 have a chronic illness. And it's actually like age 50 plus is 79.7%, 50 to 64 only 72, but it's a lot. So what the heck are they talking about? What do you mean 70% of Americans over 50 have a chronic illness? I'm sure they're not talking about a cavity. Well, a chronic disease is, well, not a cavity, but it is a long-lasting condition that can be controlled. It's under control, but it's not actually being improved or cured. So it's chronic, it's hanging around. The chronic diseases we're going to be discussing are the leading cause of death and disability in the United States, accounts for 70% of all deaths in the U.S., which is 1.7 million each year. As you know, and any of you who have watched television have seen all the pharmaceuticals that are advertised, but I dare you to tell me about a pharmaceutical made by, any of the great companies that actually cures anything. No, all we do is control symptoms. We never cure a disease. The only thing that cures diseases are things like, bacterial concerns. Well, it turns out, I don't know about your practice, but on the average, 45% of our population is now over 50, and 70% of these people have a chronic disease. So let's talk about what chronic diseases they're thinking about, and I was really anxiously looking at the list. So here's the list. These are all the ones that are affect more than 10% of the people. If you add these up, you'll see it adds up to way more than 100%. Well, the first thing I did is I said, well, let's see how many of these are inflammatory. You know, if you hear anything on the television or anywhere about disease, they're always talking about inflammation being a problem. So I went and looked, and I started looking up the research on each of these, and it turns out that high blood pressure is inflammatory. So is arthritis. I kind of knew that. I didn't know that respiratory diseases were inflammatory. Cholesterol disorders are inflammatory. I know Alzheimer's is an inflammatory problem. We know about heart disease. We've known about that for a long time. Eye disorders really woke me up. I know asthma has something to do with inflammation. And diabetes we know about. Our heart disease and diabetes have been the ones we've been telling our patients about, but I don't think any of them ever told them about high blood pressure being a problem. And the interesting thing is, now then I went and said, okay, is the risk of this disease actually increased significantly by an oral inflammatory disease? And if so, I put a star next to it. And guess what? There's a star next to each of these. So each of the leading chronic illnesses in the United States are inflammatory diseases, and the risk of these diseases is greatly increased by oral inflammatory disease. Now, if I told you this, you'd say, okay, Bob, you're pulling my leg, prove it to me, so we got to prove it. Now, the big thing is, if we have proven it, we now have a different conversation. The conversation is, hey, we've discussed that you are on medication for chronic whatever it is, COPD or high blood pressure or heart disease. So we've discussed that you're on medication for this problem. So step one of our recall visit is always look at the health history. Now our testing, and we do test for periodontal bacteria and deep pockets with a computer. So our testing shows, and see here, that you have active periodontal bacteria living in deep pockets in your gums. Now, you pull out your little research packet, which I shall show you, and in fact, if you contact me at the end of the program, after the program, I'm going to give you these papers, the research. But this research paper, and you show it to them, shows that your oral inflammatory disease, periodontal disease or sleep apnea or mercury toxicity, is increasing inflammation and fighting your doctor's attempts to treat your chronic condition. So your doctor's keeping you running in place, and this is what's keeping him from winning. Now, I've just told you that you have periodontal disease, and about then they say, okay, doc, I understand, okay, that's a dental condition. Now let's talk, let's move on and brush my teeth. And then I said, well, wait a minute, don't you think it would be important for you to know whether or not your A1C or your diabetes risk and your heart disease risk has been increased? And they say, well, yeah, that's real medicine. I said, okay, give me your finger, because we're going to test you for blood sugar and heart disease risk, and Mary will have your results in 2 weeks, and we'll give you a complete presentation, can discuss your problem and what you can do about it. Now, because of the fact this is actually a chronic medical condition, we will coordinate this condition with your doctor, and your doctor, will check on your progress every 3 months. So this is going to create relationships with MDs, which you've needed all along. Okay. You will get 4 sources of patients from this and from this presentation. Existing recall patients, and 35% of those 100 recall patients have one of these chronic diseases and are going to be a slam dunk for treating their oral inflammatory condition, whatever it is. There are also people looking for solutions on the internet to their chronic problems. It will also build physician co-management relationships. Wouldn't it be wonderful if the physicians were actually sending you more patients that you could take care of, and of course patient referrals. So this should be a big deal for generating new patients for you, and of course one of our biggest reasons for being in business is getting dentists new patients. Well, let's talk a little bit about money. I do talk about money. I'm not sure how you charge for periodontal treatment, but if you join our group, we'll be very happy to work with you on this. Normally, people do get about $450 per 2 quads of scaling and root planing, do about 2 visits of that. That's pretty normal. If you use a laser, and we'll discuss laser therapy, we suggest you add about $200 per visit for that. Perio maintenance visits are about $109. Some people charge $135. One thing you're probably not selling enough of is home care, and probably because you can't demonstrate that your home care really will keep their periodontal disease from coming back, but we do. So that's a big thing, because what we would really like to do is treat these people once, and a 6-month treatment for a class 2, a 1-year treatment for a class 3, but you're not going to have to come back every 6 months for more treatment. We're going to treat you once, this should take care of you, and as long as you're taking your home care diligently, you should be well and healthy. So anyway, it's about $2,200 with about $1,600 profit for a class 2, and a class 3 to 4, which is a 1-year treatment, costs more because you've got about $300 in home care. You also have more testing because it's more serious, and so that comes out to about $3,600. On average, you're going to find you get about 2 class 2s to every class 3, so you'll make a couple $1,000s worth of profit per perio case. Now, there are other inflammatory treatments. We talk about oral inflammatory diseases. One of them is obstructive sleep apnea, and we will help you with this treatment if you want to become involved in it, and it is challenging because there's always a conflict going on between the MDs that think they own this area and the dentists who can actually make a real impact. So an overnight sleep study is about $240 at your office. It's about $2,000 to $4,000 at the hospital. And if you give them an oral appliance, and 70% of them don't really like their CPAP, but if you can get them an oral appliance, that's about $3,500, so that's pretty good. And we'll talk a little bit about mercury removal. Now, I know it's controversial, but the interesting thing is that it's actually very profitable. Now, if somebody has amalgam fillings still in their mouth, they're going to average about 8 of those per mouth. Now, you can't just take out an amalgam filling and leave them as they were. You're going to have to refill it with something or put a crown on it. It could be anywhere from $500 to $1,200 to do that. Now, how much is 8 teeth times $500? That's about $4,000. So actually, it turns out that a mercury removal case is actually just as profitable as these other oral inflammatory diseases. So let's take a look at this, and this is what we hope to teach you how to do. You should be able to do about 5 class 2 perios a month for about $11,000, 2 class 3s at about $7,200. So that's somewhere between $15,000 and $20,000. Our CDM leader right now is in Ohio, and he's doing about $40,000. We have a couple people that really go nuts on sleep apnea. One of our practices in Oregon did about $37,000 last month. And mercury removal, I said, is the big daddy. And Dr. Joe Palmer, who I can give his name because he actually teaches courses for the IOMT on mercury removal, he averages about $100,000 a month. And I will tell you, I know of several dental practices that do $100,000 a month in mercury removal. So anyway, when you follow our instructions on this and get done with our program, you should be adding about $45,000 a month on your income if you do it all. Now, one thing you're really going to need is to explain to those patients why I'm not lying about high blood pressure, arthritis, cholesterol disorders. So this is our chronic conditions manual, and that will be something that you will really value and treasure. And I'll go through it with you just to show you what it is. Now, as I said, I'm a research nut, and I wouldn't expect anybody to believe that my periodontal disease or your mercury fillings cause high blood pressure, so I want to be able to show the research. So I went and found the research on all of these. Here's the one on hypertension. It affects 26% of the people. And this is what that page looks like on the top. I usually like pretty good references like the American Heart Association and their hypertension journal. This is actually published in Japan. This is periodontal infection is associated with endothelial dysfunction, which is how good the blood vessels work, and hypertensive patients. And this was really interesting, but there is evidence that treatment for periodontal disease can actually lower blood pressure readings. It works out to about 7 pounds per square inch if you're talking about normal patients, and it's about 14 on smokers. So it's about 7 on the top level of systolic pressure for non-smokers and about 14 for smokers. So you can have a real impact on a hypertensive patient. Now, additionally, if you want to learn to treat sleep apnea, or you do, sleep apnea is connected with heart disease. So people with cardiovascular problems such as high blood pressure, heart failure, and stroke have a high prevalence of sleep apnea. It's about 40%. So about 40% of people who have these problems do have sleep apnea, and a very high percent, probably an equal 40% of people with sleep apnea have heart disease. Now, here's one that may be surprising you a little bit, and I know that this is controversial. We'll discuss the controversy a little bit. And the ADA likes, who actually hold the patents on amalgam fillings, likes to hold the line and say, well, you know, we're going to really climb on your back, and you're not allowed to discuss this. But it turns out, if you just look at the literature, and we'll just talk about literature here, but the Journal of Clinical Hypertension, a pretty good manual, called this the role of mercury toxicity in hypertension, cardiovascular disease, and stroke. The overall vascular effects of mercury include all of this good stuff: oxidative stress and inflammation, and endothelial dysfunction, and stuff that's easier for you to read than for me to pronounce. The clinical consequences of mercury toxicity include high blood pressure, coronary heart disease, myocardial infarction, and cardiac arrhythmias. I used to think you could protect yourself from this by eating a lot of fish and taking omega-3s, but it turns out mercury actually diminishes the protective effect of fish and omega-3 fatty acids, and mercury toxicity should be evaluated in any patient with hypertension, coronary heart disease, cerebrovascular disease, or a stroke or other vascular disease. Now, notice I'm not saying this is only for people with amalgam fillings, and if you have amalgam fillings, you've got hypertension, but mercury toxicity needs to be evaluated, and it could be from anything, including the person's work, and it could be from eating too much tuna. So mercury toxicity can come from a lot of different places. You can treat it in a number of different ways, from removing amalgams to actually giving people certain supplements.
And Bob, not to belabor this point, but does the publication that you reference or cite talk about define what constitutes mercury toxicity, and does it talk about sources, and does it include amalgam fillings as a possible source? Because I think, and maybe you're going to get to this, but I think the controversy is We all know mercury is bad for you. The question is, are we getting enough mercury from our teeth to make us sick?
Yeah, well, I can certainly direct you to the IAOMT, and you can find 100 different research papers, and there are some specifically on that subject. This is more general. It does mention it, but if you're going to really dig into it, we'll show you the IAOMT website. You can go on there and look up anything you like. Now, arthritis is something that 20% of the people have. I wouldn't have connected periodontal disease and arthritis, but it turns out they are connected. The evidence accumulates for complex pathobiologic interactions. And it says non-surgical periodontal therapy improves rheumatoid arthritis parameters, showing reductions in all these big things: erythrocyte sedimentation, C-reactive protein, tumor necrosis factor alpha. See, all of these things that are just connected with any kind of inflammation are a problem with arthritis. Respiratory disease. Now, the big one here, of course, is COPD that you've heard about, and this really blew me away. It turns out there's a significant correlation between oral health status and COPD-related events, and you know, this is kind of scary, because some of these COPD-related events will put you in the hospital and kill you. So individuals who had levels of serum IL-6. Now, IL-6 is another inflammatory chemical that your body puts out if you have a chronic inflammatory condition. Those who are in the highest two quartiles were at even higher risk for COPD-related events. So you can actually take somebody who has COPD, and if they have one of these inflammatory diseases, you can lower their risk by lowering their inflammation. Cholesterol disorders. Never would have believed this one, but this is a study from Israel. There have been several since. This was the first one. It says association between periodontal pockets and elevated cholesterol and low-density lipoprotein cholesterol levels. Mental disorders, Alzheimer's disease. Now, this is kind of amazing. I won't go through reading all of this stuff. It's in the paper. But subjects with periodontal inflammation were 9 times more likely to test in the lower range of DST. That's a digital symbol test. In other words, maybe people with periodontal inflammation are just naturally dumber, or maybe the inflammation is actually getting to their mind, but they're 9 times more likely to test in the lower range of the digital symbol test. Amazing. Heart disease we know about, and if I said to any of you, do you think that you significantly increase your risk for a heart attack if you have periodontal disease? And I'd say to you, about how much do you think? And you'd say, well, I mean, it's way up there. It's like probably 30 to 50%. Well, what if the number was 270%? In other words, people with periodontal disease are 2.7 times more likely to suffer a heart attack and 3 times more likely to suffer a stroke. Any comments on that? Heart disease, as we said, sleep apnea affects heart disease, we've discussed. Mercury toxicity affects heart disease. And once again, it doesn't matter how you got it. If you got it, you got it. Asthma, 10% of the people have asthma, and asthma and periodontal disease are also connected. Eye disorders, this one I wouldn't have believed at all, but it turns out there's a thing called uveitis, which is an inflammatory eye disease, and that has a lot with these inflammatory chemicals that are running around in the bloodstream, and unfortunately some of these can actually get into your eye and can cause loss of vision. So it's called uveitis. Diabetes we know about, and we know that's a two-way relationship, that people who have diabetes are more than twice as likely to have periodontal disease, but also if you cure someone's periodontal disease, elimination of periodontal infection by using, in other words, you've got to kill the bacteria too, you can't just scrape them off, improves metabolic control of diabetes, defined by reduction in glycated hemoglobin or reduction in insulin requirements. So that's a biggie. Anyway, sleep apnea also affects diabetes, and mercury toxicity also affects diabetes. Toenail mercury levels were positively associated with a higher incidence of diabetes. So why is all this stuff true? Now, we know that periodontal disease has a certain amount of bacteria connected with it. I know that mercury toxicity doesn't have any bacteria connected with it. Sleep apnea doesn't have any bacteria connected with it. So it can't be just that the bugs are getting into your lungs. It turns out that chronic inflammation is associated with everything from heart disease and diabetes to cancer. Now, I'm sure you've all cut your finger, and you notice that your finger turns red. And what that's from is that your immune system says, hey, there's some buggers in that finger. I better send down some chemicals to kill them. So it sends down some IL-6 and some other good stuff, IL-3, and your finger turns red. It kills the bugs, and then miraculously it goes away and everybody's happy. So that's the way God originally designed the inflammatory system. Unfortunately, there's some other stuff going on that doesn't go away, and that's called chronic inflammation. And that's associated with everything from heart disease and diabetes to cancer. So if you have periodontal disease and you have the bugs in your periodontal pockets, that's not going to go away tomorrow. That's chronic. Mercury toxicity is chronic. And also sleep apnea is chronic. And what does chronic inflammatory disease cause? Well, all of this stuff. In other words, anywhere there's an inflammatory condition going on in your body, your chronic inflammatory condition is going to make it worse, make it harder for your doctor to treat, and make it a bigger problem. Now, this always bothered me because one of the first things I learned is that people with periodontal disease were 50% more likely to get things like pancreatic cancer. And I said, well, you know, that can't be because of the periodontal bacteria finding their way down into your pancreas and causing cancer. No, it's just because the chronic inflammation creates an inflammatory condition. If you have in your pancreas, if you have a problem and you've got a tumor that's trying to decide whether it's going to become cancerous, the difference might be the level of inflammation in your body, and that could turn that tumor cancerous. So that's how all this stuff happens. It's related to Parkinson's, heart disease, you name it. Okay, so how does all this happen? Well, I told you anaerobic bacteria are the key, and I know that 95% of dentists don't test for anaerobic bacteria, but if you're going to really present this and get people to believe in it, you're going to need to do that. You're also going to have to make the periodontal pockets really important and not just, well, you've got a few pockets. And what happens then if these bacteria are able to live in these periodontal pockets? And by the way, if I ask most dentists, why are periodontal pockets bad? And they say, well, the worse pockets you have, the worse your periodontal disease is. Well, that's kind of sort of it. But the deeper your pockets are, the more pockets you have, the more the bacteria can live there, and the greater your level of inflammation. So anyway, the bacteria are safe hiding in their protective pockets. The immune system then continues to release the inflammatory chemicals, causing chronic inflammation, and chronic inflammation increases local inflammation throughout the body. And this wouldn't be so important if half of all Americans over 30, that's age 30 and over, not 50, have real periodontal disease with real bacteria. That's not gingivitis. I know some people quote, oh, everybody's got a little bit of bleeding. No, I'm not talking gingivitis. I'm talking about real periodontal disease. Okay, sleep apnea. Now, sleep apnea is also connected to chronic inflammation. If you know about sleep apnea, you know that patients kind of zone out. So it's called intermittent hypoxia, where, in other words, they stop breathing and then they reoxygenate. Well, what happens is, if that goes on and off, patients with a high level of IHR had a higher circulating level of tumor necrosis factor alpha in their blood. And the interesting thing is, when they were given CPAP therapy or successful mandibular dental arches, the inflammatory factor normalized, showing that actually, in fact, that obstructive sleep apnea increases inflammation, and solving the sleep apnea cures the inflammation. Okay, now here's a couple of the things that you may be very interested in, and it might get you more interested in sleep apnea or tell you why you may be interested in it. But here's some statistics, and you know I'm a statistics nut. But it turns out that if you've had drug-resistant hypertension or chronic heart failure or congestive heart failure, you've got about an 80% chance that you have sleep apnea. Now, I'm not saying sleep apnea gives you an 80% chance of heart failure, but I'll tell you, if you've got heart failure, I'm willing to bet that you've got sleep apnea. If you've had a stroke, and Jim Rohde, a good friend of mine, told me that his wife had just had a stroke. And I said, gee, I didn't know she had sleep apnea. He said, well, how'd you know? You're not sleeping with her, are you? I said, no, Jim, but the fact is that I'm willing to bet as a statistician that if you've had a stroke, I'm willing to bet 92% that you've got sleep apnea. So there's all these big factors, so sleep apnea is a very big deal. Now, mercury toxicity, and this is a discussion of that, and we discussed it includes increased oxidative stress and inflammation, all these other good things. The clinical consequences include hypertension, coronary heart disease, myocardial infarction, and arrhythmias. Mercury diminishes the protective effect of fish and omega-3 and should be evaluated in any patient with hypertension, coronary heart disease, cerebrovascular disease, and stroke. And as I said, I can refer you to the IOMP, and you can look up the papers to see whether or not amalgam fillings really have been demonstrated to produce a higher level of mercury toxicity. Okay, now what I want you to do is learn to give your patients a free wellness assessment. The patients with these chronic conditions should be treated differently, and their recall visit should actually be what we call a wellness assessment, and you explain to them before time, you pre-frame them, and let them know that, that it really is important because of their health that they receive a free wellness assessment as part of their recall visit tomorrow. So that includes their health history, the measurement of the bacteria in their gums, their level of periodontal pockets, a snoring sleepiness analysis. If you do those, we can teach you to do that. And if you do have periodontal disease, then we'll measure your blood sugar and inflammation, and we don't charge them for it. Yes, it costs $50, but chances are that's going to give you about a 50% shot at a $3,000 treatment, so it's probably worth the risk. But we will show you what you can do about it. The important thing is, if you have heart disease, diabetes, cancer, or any chronic inflammatory condition, it's vital we co-manage your case with your doctor. Now, the thing is, if you let your doctor know that A, you have this condition, and B, it's connected to a chronic inflammatory condition that you're treating, he really can't turn you down when you say, we'd like to co-manage this case with you, and this is the way you're going to, for the first time in your practice, really create relationships with MDs. So here's the number you call to schedule your free appointment, and then we will set you up with that appointment. This is some of our software, and this is our health history that we have available and that we, you know, the hygienist can pull out. Now, this is something vitally important, and that's a BANA test. And this is a test for the red bacteria. Now, I know some people think, well, you know, I give them, I do oral DNA tests. And I'll say, I'll bet you don't. Because oral DNA tests are $107 each. So it's going to be really hard for you to get a patient to pay $107 before he knows he has a disease. But they will pay. This only costs you $6 a test. You take one of these little strips, it costs you $6, put some plaque on it here, put it in the BANA test, so 5 minutes later, you get the test back. And if the people come out with these little blue dots, they come out positive, then they have about over 5 times 10 million periodontal bacteria. If they're a weak positive, they're still over 1 million. And if they're negative, then they're less than 1 million, and they're kind of okay. You'll probably find that over 50% of your population have periodontal bacteria. I think probably averages about 70% have at least a weak positive. The other problem with the oral DNA analysis is you'll notice that it doesn't just measure the red bacteria. In other words, the P. gingivalis, Treponema denticola, the bacteria forsythus, and the AA. It also measures a bunch of orange and green ones and yellow ones, and those go up and down. So you're probably very disappointed when you do the oral DNA analysis. You treat them, and you say, wow, I'm really happy. I bet I killed a bunch of the bugs. And you killed the red ones, but the green ones actually went up. And the fact is that those go up and down. So we don't like using that too much. We really like this BANA test. Now, a big thing is pockets, and everybody measures pockets. And if I say to a patient, did you talk to your dentist about your periodontal pockets? They say, yeah, he said I had some pockets. He said they were pretty bad. Well, they don't really, what you want to really do, if you're really going to sell them on the idea that they have periodontal bacteria and that those bacteria are hiding in the periodontal pockets, then it's really important that you emphasize the pockets. We have a computer program called the Florida Computer Probe that actually calls out while you're probing them. It says 5 millimeters warning, and then at the end you can send them home with this this graph that will show them where their pockets are now and where they've been, and you can also forward that to their MD. So we feel this is a very important part of the pocket experience. Now, if in fact they do have periodontal pockets and periodontal bacteria, then we really believe it's vital for you to do an A1C test. And if they have greater than 7, then they're in the diabetic range. This patient had an 8.4. If they have greater than 3 in C-reactive protein, and that's their level of inflammation in the body, which really all this stuff we're talking about is inflammation. But if they're over 3, and they should be around 1, that doubles their risk of a heart attack. So these are really vital. We want you to learn to do those. They are little blood tests that you can do in the office. You don't have to send them to a lab. And you have a little cardboard collector here, and you put 3 to 4 large drops of blood in the collector. It'll drift down past here. It'll separate in the red and yellow with the A1C and the CRP. You send this into the lab, and 2 weeks later you've got the answer. And we will teach you how to do that too. That's part of our program. We suggest you do a sleepiness study, at least talk to people about whether they have sleep apnea and whether that could be a problem. If you need to send them to a doctor, that's fine, but it should be something that you, the dentist, discovers. Now, if you really get into it, that practice that did about $37,000 has an overnight sleep study, and this you charge about $240 for. It's virtually the same that they get in the hospital, but the one in the hospital wires them up even more, keeps them awake, and costs about $5,000. So this is a lot better. And if it turns out that they do have sleep apnea, you refer it to your sleep MD, and he'll tell you whether a CPAP is vital or whether they could use an oral appliance. And about 70% of the people who get CPAPs really can't stand them and end up getting an oral appliance. And That's $3,500. So anyway, we can teach you to get involved in this process, the courses to take, and what to do. Now, there is a mercury amalgam controversy. I won't say there isn't. It says, a dental amalgam controversy exists based on claims that amalgam in dental fillings causes mercury poisoning. So you can read this stuff, and this says there's been much discussion, and Dr. Oz controversy with the amalgam segment, and he spoke out about mercury fillings. Here's another one. Some people think that, okay, that's just a bunch of hacks that want you to, buy more stuff. But in fact, it is a controversy, and what I suggest you do is go to IAOMT.org, and you can look up the research library, online learning, technical assistance. They've got about, 50 articles that you can read, or you can become a member, whatever you'd like to do, but you don't have to be a member to read the references and learn all about mercury toxicity, and there's all the literature you'd want. Now, if you do the IAOMT process, it is a lot of work, because the fact is, if you remove amalgams in your office, you're increasing the risk of damaging your health, the patient's health, and also your team's health. So you really have to drape your body in an apron. You got to cover the patient's face with a barrier. There's a whole lot of things to do with a special air filtration system to make sure that the patient doesn't end up being worse off and end up breathing in the mercury that you're removing, because, of course, even the ADA will tell you that this mercury amalgams that you take out of their mouth have to be disposed of properly, but the staff has to wear things and high volume evacuation. So you've got to do a whole bunch of stuff. It looks like this. This is the whole checklist. My friend Dr. Palmer will help you with this. You can also, as I said, learn about this on the IOMT website. And this, you can buy all of this stuff here. It's a lot of stuff, but the rubber dam barrier, fresh oxygen, the nasal exhaust, and a body gown, a whole room exhaust. This costs you about $35 to put in. And probably, $3,500. So one $4,000 case will pay for this. All right, so anyway, that's my sales pitch. There's also a mercury evaluation of risk questionnaire. I kind of like this website, and you can go and have patients take their survey and see how serious their toxicity is. If they appear to have mercury toxicity, you can really test it with a tri-test, with a saliva test, a blood test, and a urine test. This is all three of them. This will cost about $395. We have some practices that do this in conjunction with the patient's MD, so that the MD can in fact evaluate the toxicity and say, yeah, they really do have it. So about this time, you want to get their MD involved in this process. Then we have a treatment consultation. And one thing to do wrong is if you try to sell periodontal treatment or sleep apnea treatment or mercury toxicity treatment, if you try to get the hygienist to sell it, now she's got to explain what their problem is, that they have periodontal disease, and here are the measurements, and we're going to take some more tests, but for you to really understand this, you've got to come back 2 weeks from now, and Mary will give you a complete presentation, including systems, systemic risk, research, causes and cures, treatment, and home care, and your test results, and what you can do about it. So this should not be part of the recall visit. The hygienist doesn't have time to do this. She's too busy. She's too technically oriented. You want a person who really is trained as a people person, a salesperson, and they should be doing this presentation. And one of the things we do is we help you select that person. We have tests for it in the manual, and we help you train them. This is more of our software, and you check off what treatment the patient's going to get, and it will price it for you, and you can end up with an automatic financial agreement. And this is your total fee, and these are your due dates. Now, a lot of people, you'll notice it's about $2,600 for this case, so that would be very nice, and we are very good at providing treatment plans for everybody that has a 600 treatment score or greater. If they have a score, a financial score of 500, you're probably not going to get anybody to do it. About the lowest we can find, you could do 560, and we'll teach you how to do patients that you really believe in, even though they may have a low treatment score. So anyway, we help you do that. Okay, let's talk about who you can sell with this. Now, the fact of the matter is, there are 3 million people a month. Now, I know you know a lot of people have high blood pressure and diabetes, but you know, you might say, well, they're kind of resigned to it because they're going to their MD. Well, it turns out 3 million people a month go to Google to find a solution to their chronic disease. 1 million of them, the majority of them, are for diabetes. This is what it'll cost you. These are the suggested bids for these different searches. Blood pressure is 368,000. So most of these are 300,000-400,000, but you add it up, and there's 3 million people going on the internet to find a solution to their chronic disease. When they do that, they will find your ad, and then they will be directed to your Center for Dental Medicine website, which will tell them how oral inflammatory disease is impacting their condition and where they can go to get a free evaluation of their condition. Guess where? And if you said your office for a wellness assessment, you're right. So anyway, these are some Google ads. If they have Alzheimer's, arthritis, cholesterol, diabetes, they're going to get something like this when they go on Google searching for any of these things. It says, wow, do you have this overlook factor? This is what the test looks like. If somebody searches on high blood pressure, like they put in high blood pressure into the Google search or hypertension, the first thing that comes up will be high blood pressure cause. Do you have this overlook factor? CenterForDentalMedicine.com, hypertension, free testing from a health clinic, that's you. Now, I'll admit, I don't say out here, do you have high blood pressure? You better go see your dentist. It's going to take a lot more than one line to explain that, so we will explain it, but you'll notice that you're featured out here with people like the Mayo Clinic and Wikipedia and a whole bunch of people, but you'll notice I didn't put in hypertension, Phoenix, Arizona. I didn't put in hypertension in your town, and we'll explain that a little bit because, unfortunately, your current search engine optimization program only works if you put in your location. Now, what we'll allow you to do is we'll help you define your drawing area, and the important thing is that you actually put down an area that people will come from. So if people won't really come from this town to your practice, don't include it, but we'd like to include all the areas and all the towns where people would be willing to travel to you, maybe about 50,000 people. And this is what I'm talking about. Now, if I'm at home, and this is from my house, and I put in Periodontal Treatment 85340, which is my zip code, I get a bunch of dentists. Look, this is a dentist. This is a dentist, gum disease treatment, Phoenix, Arizona, periodontal heart. Oh, no, I'm sorry. This was me. Treatment for gum disease, Center for Dental Medicine, I'll be darned. Litchfield Dental Care, General Dentistry, Litchfield Park. You'll notice there's a whole bunch of dentists here. And that's because all of these dentists' search engine program works if and only if they, in fact, put in the zip code. But if you just put in periodontal treatment and don't put in a zip code, you'll find that there are relatively few there are a few dentists that actually do pay for Google AdWords, and you will find them on here, but most of the time you'll find the American Academy of Periodontology. So if you want to be included on this side, and not just this side, you can use our program, and that's what we do for you. And what will happen is, when somebody puts in high blood pressure, they're going to go to the high blood pressure page. This is your picture. We'll talk a little bit about your personal part of the website, but it'll say high blood pressure. Is the underlying cause inflammation? It says technically the major factor in blood pressure is called endothelial function. So this explains the whole thing to them. And if they would like to find out more about it, they go here to your page. They call this phone number. In off hours, that phone will ring us, and we will, in fact, schedule that patient appointment for you. They can also schedule an appointment online, which we will also schedule for you. They can ask for a complimentary wellness assessment. They can ask for a periodontal therapy packet. Depends on what they've been interested in, but could be sleep disorders, mercury removal. There are packets for all of those. So the big thing about this is this will show them who you are, and we will do all kinds of things that you don't have on your website now to encourage them to contact us so we can put them in contact with you and schedule you an appointment.
Can you provide the packets of information? I understand objective one is to schedule the assessment, and short of that, you have a packet of information to send to people for whom perhaps the time isn't quite right. But you take care of that as well, right, Bob?
Yes, and for those people who communicate with us, give us their information. We will send them the information that they need to explain to their patient what the problem is.
Excellent.
Okay, now, I think lasers are up to 5 or 10% of the dental population now. The good thing about lasers is, first of all, you can't do it without a scaling and root planing. You do that first, but it's not surgery. It's not soft tissue management. The good news is it kills the bacteria, which scaling and root planing does not do, and it provides a 1 millimeter pocket depth reduction per visit fairly predictably. This allows you to determine how long the treatment's going to be, quote a complete treatment package, and quote a complete price, including laser treatment, checkups, and home care, and SRPs, and the patient can finance it. If you need one of these, I'll be happy to sell it to you for $59.95. Many doctors are now starting to use ozone that provides similar benefits. So we can, once again, help you with all of this stuff. One thing I will say, if I said, okay, there's a biofilm in there and here's a picture of it, go kill those bugs, you wouldn't prefer to kill these bugs. You wouldn't take a scaler in there to do it, because that's not going to kill the bugs. It may scrape the scale off of the tooth, but it's not going to actually kill the bacteria. Since 1998, we've known what kills the bacteria best is really a laser, and there's CO2 lasers, diode lasers, LANAP lasers, but the diode laser therapy in combination with scaling supports healing of the periodontal pockets through eliminating bacteria, and this has been known since 1998. So here's some more things. March 1998, laser decontamination is more effective than antibiotics. Laser plus SRP gives healing and patient comfort. Lasers provide better regeneration effects of a CO2 laser. And so anyway, this is a treatment on the fibroblast attachment to root surfaces. Okay, now our own thing, Dr. Richards, who you saw, who was one of our first dentists, and he does the training quite often. If you get a dental laser, he can train you on it. But these are some different statistics. Now, we took equivalent populations of several hundred patients who had deep pockets. And they had to have more than 5 millimeter pockets to start with. And they averaged about 5.7, 5.8, 5.6, so these are all about the same. And one group of these patients had scaling and root planing only. They had about an average of 1.3 millimeters of pocket depth reduction. Now notice that's only going to take them down to 4 something. They're still going to be class 2s, and only half of them are going to be reduced to 3 millimeters. So that's a problem. Now they say, well, Arrestin's the answer. But remember, you just put Arrestin in certain pockets, and you'll also remember, if you do oral DNA testing, that in fact a salivary test gets everything. So the bacteria are running around in saliva. They're not just in that pocket. Arrestin does help a little bit, about 0.3 of a millimeter, but our CDM system with a laser gave a reduction on average of 2.27 millimeters, 82.5% reduced to 3 millimeters, 95% 2 or more. So anyway, would you rather be about half or 80%? So anyway, it's not perfect, but it does pretty good. Here are some more reference articles on lasers and other methodologies. Here's our home care product, and this actually reduced the average pocket 2.1 millimeters without scaling and root plating, so it was more effective than Arrestin or SRP alone. So anyway, this is what we include, and this is some of the research. But notice all of these up here are really people with different kinds of lasers. This one is actually a Widman flap periodontal treatment. Okay, home care. Now, the big thing with home care is we don't want to retreat these people forever, and that's the problem with scaling and root plating. So you want to kill their bacteria once and then not have it come back. So you need a more effective toothbrush that brushes 6 sides at once and brushes everything in 30 seconds, which is all people will spend. I know that people say, okay, well, I've got an Oral-B. Well, if you read the Oral-B thing, it says, sit there and brush for 2 minutes. Go time somebody, they won't do it. Now, also, you can't get people to floss very effectively. The HydroFloss actually puts an electronic magnification on it, which kills the bacteria and prevents the calculus a lot better. Closest 2 kills bacteria and neutralizes the sulfur compounds. And our physician periodontal formula builds up the defense system and kills the bacteria. So let's just take a quick look at this. I'm not going to read all the research for you, but I will, when we hook up for an hour program. But a HydroBrush gave equal or better performance to Oral-B and Sonicare in just 30 seconds. The HydroFloss, irrigation with magnetized water, resulted in 64% less calculus than just a water pick. Physician's periodontal formula reduced bleeding and probing depth without SRP, an average of 2.1 millimeters, which is more than Arrestin and SRP alone. This was done by Loma Linda University. Closest rinse eliminated mouth odor for 8 hours. This was back in 1999. Closest toothpaste and rinse, they took a patient that had a sample that had thousands of bleeding depths, and this actually reduced the bleeding 72%. So 72% of the pockets that had bleeding were normal and had no more bleeding after the closest, and 67% saw a reduction in probe scores. So I'm not saying that this is all you need, but it sure is pretty powerful after you've already treated them, and it certainly does help keep it from coming back. So here's the question. What if we could get 20 new patients a month to call your office for periodontal treatment to help their chronic condition? And you can say to them, do you have chronic, whatever it is, and modern medical research can now combat the problem without drugs. Find out how you can advertise on the internet and pay only for the highly motivated patients who respond, provide an effective and low-cost screening program, provide oral inflammatory treatment that kills the bacteria and normalizes the pockets. Now, another thing you'll find is that once you get on this, that the newspapers and television in your area. Now, it might not work in New York City, but it will work in places like maybe Cincinnati. But we do have a public relations firm, and the public relations firm will negotiate on your behalf and let them know, target the local newspaper, radio, talk station, etc., and we may be able to actually get on their program. We have had several practices visited by the television stations during their training. Okay, now another thing we're doing is we know that more patients need to learn about the dangers of oral inflammatory and periodontal treatment. And so what we're doing is we're raising ads for funding right now. If those of you would like to invest in this and invest in Centers for Dental Medicine, we're raising $150,000 to do that. And we'll be very happy to discuss that investment with you. And we believe that that investment can pay off about 40 times within 3 years. So what you need to do is you need to get on our search engine optimization program, and we will schedule your patients for wellness assessments. When you have openings, we're going to have a joint calendar. You will have a program to present the connection between their chronic condition and their oral inflammatory disease. You will be able to diagnose the oral inflammatory disease, periodontal disease, sleep apnea, and mental toxicity. You will have a proven system of patient management from contact to contract to treatment. And so we have a monthly program we can prescribe for you, which includes coaching, testing, brochures, magazines, SEO, internet, and you can pay for it monthly, and we guarantee you that you will make more on it per month with just one patient than it costs you per month. So anyway, that's our promise to you. And now I know that all of you are saying, well, you know, who can I talk to about this? And I don't want all of you calling all my guys, but here's what we've done, because we've been in business for a number of years, and we know that people really want to hear success stories. They really want to find out from individuals, from the doctor, how it's impacted his practice. So there is a website called Center for Dental Medicine News. That's not Center for Dental Medicine just alone, but Center for Dental Medicine News. We showed you the Center for Dental Medicine link, but this is news, and you'll see things like how to become a CDM, CDM success stories, classic webinar archives you may want to look up. But these are the Center for Dental Medicine success stories, and we say the satisfaction of our customers is our most important product and something we're sure you're interested in. The challenge of following up for referrals is both your time and their time are very limited, especially during the workday, so getting together is almost a perfect storm. To ease the process of the perfect storm, we've listed practices below who are willing to receive calls during business hours for references, but also have prepared a statement for you which includes the answers to the most asked questions. The most asked questions are, why did you become a Center for Dental Medicine? What changes do you have to make to your practice? How long did it take for you to see results? What advice would you give prospective Centers for Dental Medicine? So let's take a look at some of these. And here are the success stories. And we start out with 2004 with our first clients, and these guys are still our buddies, and you can call them and find out about us. These are our latest ones, but there's about 20 of them going from 2004, to about 2013, and you can look at their success stories, find out about it, and get your questions answered. So anyway, we're here to help. So please contact us, and you can contact me in person. I'm Bob Schulhof. I'm the CEO and founder of this company, so you've got a direct line to the top. My personal cell phone is 480-203-6372. My personal email address, and if you just send me your name, address, and phone number, then I'll be happy to send you the information you need to get hooked up with us. So I recommend you do that. You can also check on CentersForDentalMedicine.com, Centers for Dental Medicine News, and ask me any questions that you have.
Fantastic, Bob. Thank you very much for that and for finishing in a sufficiently timely way so that we can get to the numerous questions that our attendees have asked me to ask you. Before we do that, you and I kind of talked offline. I said, well, this is a pretty switched-on group that typically attend these webcasts. They get the oral systemic connection. And you agreed to offer them some things that I think are very generous. And I wonder if you just take a moment or two to share with our attendees what you're willing to do for them.
Okay, here's what I'm going to do for you. This is one of the most valuable things that I have. And I never thought I would hand it out to anybody who didn't promise to sign up, but I think I could twist your arm after that. But this is the Chronic Conditions Manual that you saw, and it's what you can use when you talk to your patients about their high blood pressure and why that's actually connected to their periodontal disease or mercury toxicity. So this is all of the research that you saw in here. Is that clear, Danny?
Yeah, it is. It's very clear. And I know that we talked about how valuable this is, and then I kind of asked you, I said, well, that's great, but, you know, what else, to what extent is this going to be successful without having the entire team on board? And well, you just tell everybody what you told me and what you think we need to do as a consequence of that.
Well, I will say that the first thing you need to do is the team really needs to understand all this stuff. And I am willing to give you, as part of this project, if you send me your information or call me, I will not only give them a manual, but I will also do a 1-hour presentation to anybody on your team that wants to learn what you've learned here. And I think that will really be the beginning of a great relationship we will have.
And just to underscore, the point you made was that without the teams getting this and practicing it, that you really, I think, you haven't seen a whole lot of successful practices where the you know, the knowledge was sort of at the top. So I think that's great. And
now I will say I have had practices that succeeded for a little while, and then we're no longer successful. And I'll look back at them and I'll say, what the heck happened? What are you doing now? Who's you know, who's doing the patient presentation? And they said, well, we get kind of busy, so really we have our hygienist present it all during the recall visit. Because we're just so busy, we've got so many recall visits and so many patients, we didn't have time to do it with a special person, with a treatment coordinator. And our treatment coordinator left and we haven't trained a new one. Well, let me tell you this. Those patients have about a 25% case acceptance, and it certainly would be worth it to have a 50% case acceptance of a $3,000 treatment. So number one is no more of this. The hygienist is going to do it during her busy recall visit. The hygienist will measure their periodontal bacteria, measure their pockets, and do their test and measure their CRP and A1C, but then she will send it in, and 2 weeks later, Mary, the treatment coordinator, who we will train and we will select for you, will actually present it. So anyway, that's really one of the first problems.
Yeah. That's great. All right, let's go ahead and get to the questions, because I tried to sort of screen. Some of them were similar, but we've got 8 questions, I think, that we're going to try to get to. The first one is, how is the screening fee if mercury toxicity test is $395? That's verbatim. I hope that's clear.
And what is that?
How is the screening free if the mercury toxicity test is $395?
It's not. The thing that's free, thank you again, is just the initial, the thing that's free is the initial periodontal pocket depths, and we can give them free the little test that's online, the online test, and that will tell them whether or not they seem to be, their amalgam fillings seem to be causing a significant problem. Is it causing mental problems? Is it causing, there's a whole list of problems it can cause. I could go on and show you if you wanted. But anyway, there is a little online test you can give them that will tell them if their mercury toxicity is serious. The next step is to discuss it with their MD, and then there will be a $395 charge for the mercury toxicity test. No, you can't give that test away. I would never suggest you giving away more than $50 worth of tests to get a new patient.
Fair enough, and I would agree with that. I try to sort these maybe in the easy, the quick answers first. How does HydroFloss compare to the latest water pick?
The water pick does not really have the same electronic charge as a HydroFloss does, right. And what you will find is that according to the research, it 64% less calculus.
Are you familiar with the air floss by any chance?
No, I'm not familiar with that one in particular.
Yeah, I got one, and I've been using it occasionally. It just pulses air and shoots the stuff out that way. But I was just curious.
Anyway, I'd be very interested in any research anybody has that would give me the latest or something I don't know about sure. What another product does.
Well, I'm not surprised to hear it, and yeah, anybody that has anything they want to share, this is a. I know when I give a talk, I always learn something from the attendees too. So that's great, and I hope someone does take you up on that. Is the PRA within the realm of dental board advertisement acceptance, or can a doctor be cited and pay a fine? The Dental Practice Act, I think, is what they're referring to. You know, has this been? I mean, you're always. I mean, I could answer this too, but
there is always a certain risk,
right.
That, and it depends a lot on the area that you're in. I know I was talking to a practice in North Carolina, and they were very worried about violating the Dental Practice Act, and they sort of stayed away with anything where they could be accused of being an MD. But I will say that, you know, most of our patients find that the things that we recommend for them and the way we tell them to do it, that there's not a problem. And I will say that in pretty much every state, there wouldn't be a problem with you doing a finger stick test to do the A1C and the CRP. And if you thought your state didn't have a problem, the patient could actually do it themselves. They could stick their own finger, put a little blood on there, and that'll do it.
Mm-hmm. Do you recommend any explicit disclaimer verbiage, you know, that we are not MDs or anything along those lines?
No.
Okay, good. Because, you know, typically, I mean, I guess, you know.
By the way, I've been here 10 years, and nobody's ever found it a real problem.
Yeah, and I was just going to say, we've been doing marketing for dentists for 25 years, and I think maybe I'm aware of one doctor that was fine, and it wasn't for something that we did. But, you know, there's certain, some common sense, and the Dental Practice Act, the section for the state is usually not that long on marketing. You can read it, and, you know, it doesn't want to make comparisons. You don't want to say you're better or worse. And obviously when you're talking about things along the lines that could suggest that you're an MD, you just want to use common sense. And often the worst that happens is they ask you to stop. And, of course, if you printed 1 million brochures and they tell you to stop using them, that can hurt. But if it's an ad and someone says you need to cease and desist, well, okay. That's sort of the worst.
Well, yeah, I agree with you, and I've always automatically, and if you look at our website, you will never find anything that suggests that this is the only dentist that can do this. And we're a lot better than everybody else.
Right, you don't make comparisons, because that's no.
No, we don't make comparisons. All we do is clearly define, you know, the relationship between the disease that they have certain chronic inflammatory diseases, and here's the research behind it.
Very good. Okay. What are the top challenges? This is a juicy one. What are the top challenges preventing practices from successfully enrolling patients with this approach?
What was that?
What are the top challenges that are preventing practices from successfully enrolling patients with this approach?
Okay, well, one of them is, I told you one of them is trying to have the hygienist do the enrolling as part of the visit. Another one is not pre-framing. In other words, you want to have a wellness assessment. You don't want it just to be seen as a recall visit, especially those patients who have, we actually have a whole process called pre-framing that will teach you how to do, and it's very, pre-framing is very highly correlated with success. So what you do is you look over the patient's history, and you know the people that are coming in tomorrow, and you know the ones that have had periodontal problems in the past, and you put down their pockets and they're bleeding and they don't care. Well, the patients that have had some periodontal problem in the past or that have a chronic, any one of the 8 chronic conditions, you're going to want to give them a wellness assessment the next day. So when you call them up to remind them of their visit, you say, now I know that you have chronic high blood pressure, and your MD has been providing medication for that. Well, we would like to give you a wellness assessment to make sure that no inflammatory conditions, no oral conditions are causing you a problem. So tomorrow, instead of just your regular recall visit where we brush your teeth, we are going to be giving you certain tests. We're going to be testing you for periodontal bacteria, for other problems, for things that might indicate inflammation. And we will be doing that at no additional charge, but we do want to let you know that we really care about you and your health is of vital importance to us. And that's it. If you set them up with that, and then they come in for a free wellness assessment, and then the hygienist does what she's supposed to do, and then they get the A1C and the CRP test, and then you send them to somebody who's using our patient presentation and has been trained by us, you're going to score about 75% in most places.
That's a pretty good batting average by any measure.
I mean, I'll settle for 50. You know, I would really, as I said, I'd be willing to settle for about $40,000 a month.
Yeah, I think most of our listeners would. I can envision a form of culture shock within the practice if we simply and immediately adopt your protocols. Do you agree? And if so, do you recommend gradual implementation?
No. No, what I really recommend is I recommend that all of your team start thinking this way and start understanding that, boy, you just gave me an idea. You know, what I really need is a brochure on this that you can have around the office.
For the team or for the patients?
No, for the patient, to hand out to the patient. That's a beautiful one. But I want the team to be very aware of it, the whole practice to be aware of it. I think what I'm going to have to do is to create, and I will create, a brochure for it. And as I said, we will want all the patients to become aware of it and to actually take home the research that applies to their particular problem.
Yeah, because I think
what show it to their friends.
Yeah, the culture shock, while I understand the concern, I think it all depends on how you implement. And if you run the race at the patient's pace, it's not like every patient now is going to have to submit to this protocol. It's not my way or the highway. It's a shift. It shows a commitment to being leading edge. And a lot of people say, well, we haven't been oral systemic, so now how do we all of a sudden become oral systemic? Well, you know, you say it's an evolving technology, which it is. It's rapidly changing, and you keep your finger on the pulse, and you do it so that you can benefit your patients. And it took, you can even say, we didn't learn this overnight either. We don't expect you to learn and embrace it immediately, but this is where we're at, and we thought you'd be interested in knowing about it. And then run the race at their pace.
Now, we also have a 273-page manual with everything we cover in it that, your people can look up. So we know they're going to have to learn. And as you said, it depends a lot on the practice, but most practices will be very happy to schedule 1 or 2 patients a day for wellness assessments. I suggest 2, and that way you're probably going to get 1. And all right, so you'll end up with maybe about 10, 20 patients a month that way.
Well, once you get on the learning curve, it'll increase rapidly. In general, how successful have dentists been receiving medical referrals?
In general, it has been the most frustrating thing in my lifetime. I thought for sure that as soon as MDs found out that a dentist could in fact help them lower the risk of heart disease and diabetes, that they would be all over it and referring people like crazy. And so we worked with Lee Osler, we worked with people to buy books, and we educated people. We did presentations at hospitals, we did presentations at diabetic clinics, and we got like Zippo from it. The only ones that were really good where we did tend to get referrals from naturopathic physicians because they tended to believe in what we were doing. But
well, yeah, and we're surrounded. Sometimes you're preaching to the choir, and you begin to think that everybody gets it. But I just had a little dose of reality. I was on a climbing expedition, and over the course of my travels, there were 3 cardiologists, 2 on our team and 1 on another team. And I mentioned the American Academy for Oral Systemic Health and a little bit about our work, and I got a pretty cold reception. It's like, that stuff's all out there, and then the research isn't in. I said, well, and I'm thinking, well, have you investigated the research? Do you even know what I'm talking about? So, you have to run the race at their pace too, but you've got experience with it, and the verbiage. And as Lee shared with me and with you, and you shared earlier, I mean, they're obligated to collaborate with a patient that you have in common. So it's just how
they really are obligated, especially with those patients who have a medical condition, and this treatment is targeted at that medical condition.
Right. And as long as you show the physician how it's in their interest, because people are motivated by fear and greed. They either want to stay out of trouble or they want to look good to their
But
patient.
the fact of the matter is, the average physician only has 6 minutes with the patient. So I've even had people who had physicians as relatives. They took them to dinner. The physician learned the whole thing backward and forward, but they didn't have time to say a word about it. And they also weren't going to refer somebody to a dentist. That's not what they do. They refer people for testing where they can make money on the testing.
All right. Well, it's sort of in a related vein. Next question is, how does your approach improve the volume of medical referrals?
Well, the fact of the matter is, as I showed you, what you will do is you will contact the MD, and you will say, hey, here's Johnny Smith. There's a letter for it, and the letter says, your patient, Johnny Smith, has the following chronic condition that you're treating him for, and you're, he's on this medication. And he also has periodontal disease, and this is increasing your problem and increasing his risk for high blood pressure. And therefore, and we do believe, and this research shows, that we might be able to lower his blood pressure through his treatment, and therefore we would really like to co-manage this case with you, and we'd like you to check on the patient every 3 months and let us know how we're doing. Now, the doctor can say no to, hey, would you tell your patient about periodontal disease or something like that. He cannot say no to, your patient has chronic high blood pressure. We have something we have a treatment that can help him, and we would like to co-manage the case with you. He can't say no. And this is a totally new ball game because in the old days you could always say no.
Very good. All right, this is the last question because I need some time for some closing remarks. In your research, have you come across any connection between chronic dental diseases and leukemia, specifically AML? Is that amyloidosis? I'm not sure, but there is clearly a personal interest in this for me, as the daughter of close friends has just recently been diagnosed with this.
No, I haven't in particular. As you see, when you saw my list of diseases, you didn't see leukemia as one of the cancers that was mentioned as being connected to inflammatory disease. Okay. It may be true, but I don't know that it is, and I haven't seen it, and I may just not have read about it. I don't know everything.
Right. No, but you know a lot, and I think that was very clearly illustrated. And I want to thank you for that tremendously on-point presentation. And I want to thank you for the offers that I really do hope the attendees will take you up on. It's very generous, and I'm sure some of them will, it'll be time well spent. I'm sure many of them will choose to adopt your model. And I just want to remind people, in a few days you'll receive an email with instructions on how to receive your 2 hours of CE credit. And now I want to invite you to please mark your calendars for our next webcast, which will be on Thursday, December 18th at 6 p.m. Central Time, when our special guest will be Dr. Jim Hyland, who will present Stop the Bleeding, Predictably and Consistently Control the Cause of Periodontal Disease, Breath Odor, and Other Links to Oral Systemic Health. Until then, this is Danny Bobrow thanking you for your continued commitment to practice perfection, and especially to you, Bob, for a wonderful presentation. Thank you again, and goodbye, everybody.
Thank you.